So that's 1 o'clock, everyone. I think we'll get started. Good afternoon and welcome to this interactive workshop to introduce you to our serial prescription toolkit. Just to remind you that this session is being recorded. It's really encouraging to see so many of you joining us today. We have over 130 people registered for this workshop. We've had over 500 across all four, so we're really grateful. And we are aware of the sustained level of pressure being experienced by your teams. We'd like to take the opportunity to note our appreciation and thank you for investing your time in joining us today. So if I can have the next slide, please. We'll start with a quick introduction of the presenters for this session. My name's Eloise Johnston. I'm the Senior Improvement Advisor who's leading these digital workshops to help you implement serial prescriptions in your practices. I'm joined on the call today by Mark Easton, who is our Community Pharmacy Clinical Lead, and Adeline Tan, our Improvement Advisor. Many of you will know Leslie McFarlane, who is the Senior Improvement Advisor leading the Pharmacotherapy Collaborative before and during the pandemic. She's moved on to a promoted post within Healthcare Improvement Scotland as a Portfolio Lead in Excellence in Care, and we're really pleased and wish her all the best in her new role. We're also delighted and really grateful to have Elaine Payton, Margaret Robertson and Caroline Gault on the workshop with us today. Elaine is NHS Greater Glasgow and Clyde Senior Prescribing Advisor, and Margaret and Caroline are the Chair and Deputy Chair of the National Community Pharmacy eHealth Facilitators Group, and I'm hoping they'll be on hand to respond to queries via the chat box as we go along. I'm just going to hand over now to Adeline.
Hi, good afternoon. Before I start, I'd like to run through some basic virtual housekeeping to ensure you get the most from this experience. To minimize noise interference and maintain streaming quality during the session, we have muted your microphones and turned off your cameras when listening to the presentation. We will be recording this workshop and it will be posted on our pharmacotherapy website. We will email you to let you know once that is posted. We have set time during this session at different points to pause for you to ask questions and for us to answer. You're invited to interact with us during these pause sections by raising your virtual hand and unmuting your microphone. You can also use the chat box to ask questions throughout the workshop, and you should find the chat icon at the top of your screen. We have recorded the Serial Prescription Toolkit webinar that we have ran in October, and will be publishing it shortly on the pharmacotherapy website. We will be adding to the resource from these series of digital workshops, and the update will be available towards the end of January and will be circulated soon after. If you are experiencing any technical issues, please let us know in the chat box so that we can help you resolve it. Finally, please know that any text in the chat box and any video and verbal communication are recorded and will be published on our pharmacotherapy website. Next slide, please. The aim of this session is to provide you with a demonstration of the toolkit's functionality, an opportunity to ask questions and share experiences of setting up or reviewing serial prescription processes. We are discussing Step 5 and Step 4 today. Our workshop's target audience today are the community and primary care pharmacy teams, practice managers, and administrative staff. Whether you are from one of these groups or play a different role, you're all very welcome today. Next slide, please. We'd like to learn a little bit more about all of you. So can you pop in the chat box your name, where you are in the country, if you had joined our Serial Prescription Toolkit webinars in October or our digital workshops the last 2 weeks, and also let us know your expectations for joining this session today. And I'm going to keep talking while you do that. If you look at the heat map we've got on the slide today, it's really nice to see where everybody has joined us from the introductory webinars in October. So I'm going to hand you over to Eloise now.
Thanks, Adeline. If I can have the next slide, thank you. So thanks for your participation into the chat box so far. It is really helpful for our planning to understand whereabouts you're joining us from. And while your comments are continuing to pop up into the chat box, I'd like to take a really brief pause here at the beginning to set out our intention for the atmosphere that we'd like to create for today's workshop. So we know as a team from our collaborative work with primary care teams over a number of years that someone in the room usually has the answer, and we see our role today as presenting the resources and perhaps more importantly, providing the opportunity for you to ask questions that can help you really plan and implement serial prescriptions in your team. So this is the last of the series of 4 workshops, and the focus today is very much on the dispensing stage. We'll be taking you through the toolkit to show you more of the detail. We won't have time to open every individual document, but we will explain how the toolkit's structured and we'll highlight all the resources that are included within it. Next slide, please. So this slide shows a really helpful document that's currently hosted on Scottish Government's website, and it sets out what the Medicines Care and Review Service means for patients. And it describes serial prescriptions as pharmacies working with GP practices to help people get their medicines at the best time for them. If people are prescribed regular repeat medicines, they may be able to have a serial prescription if their prescriber thinks it's suitable. A serial prescription can be issued for 24, 48 or 56 weeks and will be kept by the community pharmacist who will dispense it in regular intervals as prescribed. This means that people can get their repeat medicine straight from the pharmacy without having to order a prescription from the doctor beforehand. So when transferring to serial prescriptions, it's essential that you test your processes to ensure that they're safe and improve quality for the practice, the pharmacy and the patients. And some of the benefits of using serial prescriptions are that it can be more convenient for patients. It can reduce some of that unnecessary footfall and the phone calls to the practice. It can potentially reduce some of the workload associated within the practice, and it can really support our colleagues in community pharmacy in coordinating and planning their workload. Next slide, please. So we initially started work on this pharmacotherapy collaborative at the end of 2019, and then when we remobilised after the first lockdown, the feedback was that a focus on implementing serial prescriptions would be the thing that was most useful to focus on for practice teams. Between November 2020 and March 2021, we worked with 53 GP practices across 8 health and social care partnerships in Scotland to develop and test new and existing practical guidance and resources. And the resulting toolkit that you see on the screen just now is a combination of national NCR, some co-produced iHub and some locally shared resources. We're absolutely delighted that we've had this toolkit endorsed by RPS, and we're currently working through that process with RCGP. So the toolkit itself is an interactive PDF, and it's designed as a cycle of 5 key steps. So planning for serial prescription processes in your practice, selecting your patients, setting up your serial prescription processes, discussing serial prescriptions with your patients, and dispensing serial prescriptions. And at the centre of the implementation are the quality improvement or QI tools that support the processes. So it won't come as a surprise to anyone on the call that GP practices all have degrees of variation within serial prescription processes and experiences, and the toolkit is designed so that you can click onto the icon that you want to review. The toolkit only consists of 9 slides in total, and you can scroll through or click on any of the icons highlighted in red, which will take you directly to a specific page that includes a range of resources. Can I have the next slide, please? So this is what the page of resources for each of those key steps looks like. And we've used the setting up a serial prescription page here purely as an example for you to see how it's been created. And you'll see a number of red highlight boxes appearing as I start to explain how it's been put together. So the page is divided into purpose and resources. And within each purpose section, there are some resources which have been categorized into guidance, tool, and training, and each resource has an icon to denote its category. Where you see bold text, this denotes where the design team agreed that this was a key document for you to consider. And some steps also have additional sections on good practice resources. And if at any time you just want to return to the front page, you simply click on the home icon at the bottom. So just before I hand over to Mark, I'd like to make one small additional point for today. So some of the documents we link to within the toolkit use references to CMS rather than serial prescriptions. And whilst the term CMS is a little outdated, the processes are the same. So today we'll be referring to CMS at points where that matches what's in the actual document. And so hopefully that avoids any confusion as to why we're using both terms. And at this point, I'm going to hand over to Mark Easton, our Community Pharmacy Clinical Lead, who's going to take you through the next slides. Thank you, Mark.
Thanks, Eloise. So if I can have the next slide, please. Oh, sorry, we're there already. Thank you. So what we want to do today is have a look at one of the key areas of a serial prescription. But before we do that, just a quick reminder of the journey of a serial prescription. So what you have on your screen here is one of the key national documents that we introduced during workshop 1, which was the planning stage. And this is the process map for the journey of a serial prescription. And it's designed to help your teams to walk through that current process they have and hopefully identify any gaps that they may need to work on. So a brief reminder, as has already been said today, we have already had workshops on inclusion and exclusion criteria, shared care agreements, identification of potential patients, screening and review of individual patients, and also the creation of serial prescriptions. The links to those workshops will be posted. You'll get sent emails to those, and they should hopefully be available for review at the beginning, sometime during January. So you can look out for that email and you can go back and review the workshops and obviously pick up any areas that you feel you need to develop further. Next slide, please. So, dispensing a serial prescription. Once a serial prescription has arrived in the community pharmacy, one of the pharmacy team will explain to the patients how the dispensing process is going to work for them, and they'll agree dual consent. So any questions that the patient might have at this stage will be addressed within the community pharmacy. Now, every time a claim is made for a dispensing event, and I urge you to note that it's the claim which triggers the information, not the dispensing of it. So when the claim is made, the GP practice will receive an electronic notification, and then on completion of the script, they'll receive the treatment summary report, or TSR, and this will also request a new prescription. A couple of documents that we have provided for you are the FAQs, the frequently asked questions for community pharmacy, and that provides a range of answers to some of the concerns that you might have about the dispensing process. And that can be useful on both sides of the fence. So the community pharmacy may have questions themselves, or the GP practice may have questions about what's going to happen to the prescription when it's in the pharmacy. So that's a useful resource regardless of your part in the process. Also within the toolkit planning section, you'll find the community pharmacy quick guide, and that's another really useful document. So we would point you to that one as well at this stage. Next slide, please. So the guide to producing treatment summary reports is there to help understand how the community pharmacy and the GP teams can use the TSRs. Now, TSRs appear to have created quite a few questions over the course of our webinars, and that's great because we do love questions. That's where everyone learns. So the key thing here is that the TSR is a clinical document for communicating clinical information relating to the serially prescribed items. It's sent electronically from the pharmacy to the GP practice and includes some care summary information and or a request for a new serial prescription, and it should be considered by all parties as a clinical document rather than simply a prescription request form. Now, as TSRs are embedded into existing processes, there is an opportunity to use this information at some point to enhance annual medication reviews. So please look at that as an option and see how you can build that into your current processes. Next slide, please. Sorry, can we go back one? Thank you. So patients must be registered by the community pharmacy for the MCR service, which is the overriding family of services with where serial prescriptions sit within a community pharmacy. So they must be registered to enable the serial prescription to be dispensed. And this includes patients agreeing information on information sharing, so that information can be sent electronically between the community pharmacy and the GP. A nationally developed community pharmacy quick guide includes, which is included in the planning section, includes some clarity there regarding this requirement. And that section is the section you'll see highlighted on your screens. And again, if depending on what size of screen you're using, if you're struggling to read that, don't worry, it's in the toolkit. We're simply pointing you to it at this stage. Next slide, please. So this slide shows an example of a serial prescription community pharmacy tracker. So this is something which many boards may have already introduced, and pharmacies may be using this within the practice. Now, this is a paper tracker, and it's clearly it's not necessarily something that everyone's going to use, but it has several benefits that you may find are useful. So it gives a simple range of key dates. So it notes the dates when a prescription is collected that would be reflected on the patient medication record within the pharmacy. Any relevant information can be added in the comment section, and that then can be transferred onto the TSR, the report at the end of the prescription. For example, things like as and when required medicines may not have been required, or early dispensing due to holidays, that type of information that helps the practice to make useful use of the data they get back. So we'll also be a note there of the date when the TSR is sent and when the next dispensing episode is due. So that helps in case there, for whatever reason, the new serial prescription hasn't arrived by the due date, in which case the pharmacy can contact the practice to have a conversation about why that may not have happened. Now, this piece of paper stays with the GP10, and that is a way of preventing the serial prescription from being added to the bundle of prescriptions or repeat prescriptions at the end of the day, because the prescription would be held rather than sent away at the end of the month. And the tracker obviously is updated at the point of collection. So that's an example of a locally produced tool, and something that some pharmacies may be using and may find useful. So if we have the next slide, please, we're just going to take a minute to ask if there are any questions that need addressed through the chat box.
So we've not had any questions, but Elaine has made an advice around that most of the community pharmacy IT systems have a tracker inbuilt into their own system, and we will encourage the pharmacy team to use their PMR as much as possible rather than a paper tracker. Some pharmacy may prefer the paper tracker, but the primary direction should be towards a PMR tracker.
That's great, thanks, Ellen. My own practice, I would always go for a paper-like option if I possibly could. And as Elaine has highlighted, the PMR systems will all have some form of tracker built in, and it would be advisable to try and use electronic systems where we possibly can. Anything else coming through, Adeline?
No, nothing else has come in.
No. Okay, in that case, we'll move on. Can I have the next slide, please?
Sorry, Mark. A question just came in around, is it worth touching on the PCR?
Okay. For this particular workshop, I would suggest that we don't discuss that at this point, simply because it's likely possibly cause confusion around the needs. The PCR is the pharmacy care record, which is an electronic record. Essentially, it's held as a web service, and it's input by the community pharmacy, and it does what it says on the tin. It's a care record, so it's a record of care issues and things that the pharmacy have dealt with. It sits in parallel with serial prescribing. It was initially, for those of you who were involved the old CMS as it was part and parcel of that process. It's now been divorced from that, so they run in parallel. So it has a place. If anyone has any particular concerns about it, please get in touch with us, but I don't think we should be spending any more time on that one within the confines of this conversation.
Thanks.
So, sorry, yeah. So moving on, ongoing management of the prescription. So as we've said, the GP practice will receive a TSR on completion of a prescription, and that should include, if necessary, the request for a new prescription. The TSR is also a prompt for ongoing medicine review processes within the practice, so that they can be done in a safe and a time-protected manner. And as teams develop their skills around serial prescribing, then they will tend to find that this is something they can mesh, and it works incredibly well, just pulling everything together. That said, the two processes are separate, so in the early stages, really it's important that we don't get stressed about those things not happening together in sync. It would be useful to consider as part of the implementation process, however, what your TSR management process is going to be. So a document defining who will read the TSRs, who will action the TSRs, how they're going to be included in your workflow. For example, are you going to use Mail Manager, Docman, tasks, daybooks? All that would be good to provide clarity of roles within the team. So we would encourage that as part of your planning process around who's going to handle the TSRs. We should also highlight at this stage, because this is an ongoing theme, that if you're starting into the serial prescription journey, be cautious around how many serial prescriptions you introduce at one time, because those will create TSR workload altogether at some point in the future. So staggering your implementation is a good way of managing your workflow going forward. So TSR, the GP practice team must ensure that TSRs are reviewed, and if appropriate, patients are invited for appointments, whether it's for blood tests or reviews, before the next serial prescription is issued, in time for the new prescription being required. And this slide simply shows a local vision document. We also have an EMIS equivalent, which is currently being reviewed and in due course will be added to the toolkit. Next slide, please. And this slide shows a local example again. This one was developed with a practice in NHS Grampian on managing the TSR process within Mail Manager. So I've just mentioned there that Mail Manager may be one of the tools that you use within this process. Again, I should say we've also been set an EMIS equivalent, and that will also be added once it's been reviewed. But before we move on to discuss the resources around communication with the patients, there are just a few things I want to highlight with regard to medication changes and synchronizing those, because that's a key element of the dispensing and the management of the prescriptions. So the things to note are that a serial prescription item cannot be amended once it's been sent. It can only be cancelled and replaced by a new item being issued. Changes are at an item level, not at a prescription form level. So you don't cancel a whole prescription, you cancel one item. Cancellations must be communicated to the community pharmacy team as you've defined within your shared care agreement. So don't rely solely on the electronic message transfer. The reason we say that is there can be situations where the internet options not available due to technical problems, and the pharmacy then has to rely on the paper version. If the paper version is not updated, which it would be normally with the new electronic message, then the team are left in a position where they're not informed that something has been cancelled. So please communicate those things, both within your shared care agreement and also cancelling the item on the electronic prescription. Now, if a new serial prescription item is added part of the way through a 56-week, then the best advice is to issue a full term prescription, i.e. another 56-week prescription. Unless, of course, you happen to be really clever and spot that it's landed exactly halfway through, in which case you could issue a 6-month prescription. But the guidance is give a full prescription, because the community pharmacy team will be able to dispense less than the amount on the full prescription in order to synchronize everything together. So the prescription allows the team the right and the authority to supply, but equally, when that TSR is set at the end of all the other items, then they can simply force finish the existing item that's only half dispensed in order to synchronize the new prescriptions at the TSR stage. And finally, after TSR has been sent with a request for a serial prescription, the items requested can no longer be dispensed from the pharmacy on the old serial prescription. So the TSR sending process finishes the life of that prescription. So if we have any other points there, then we'd be happy to take any more feedback or questions.
So no questions has come up as yet. Elaine's just mentioned around the point before in using the PCR, that it is part of the community pharmacy contractual obligations associated with the wider service to record any interventions regards to medication related care issues. So not just specific for serial prescriptions. And Margaret has said if all the serial prescriptions are of 56 weeks, when you come to reauthorize, it is a very few clicks on the GP clinical system.
Great, thanks for that additional feedback. That's really helpful. So if there's nothing else coming through at this stage, and even though we move on, if you do have things that you want to pop in the chat box, please feel free to do so. But I'm now going to pass back over to Eloise.
Thanks, Mark. So the stage we're going to cover now is around communication with patients. And obviously, if you have attended any of the previous 3 workshops, you'll be very quickly spotting that we're covering the same resources. It's the same part of the toolkit. This is obviously for the benefit of those attending today for the first time, but hopefully there'll still be an opportunity for you to learn some things, perhaps from the questions that come in via the chat box. So clear and effective communication with patients really is key to an efficient transfer from repeats to serial prescriptions. And when undertaking that move to using serials, you should consider at the earliest stage possible how to discuss with and inform your patients of any changes. So this is the point where you and your teams know your patients best, and good practice is to get that consensus on your communication strategy, so how you're going to work as a team, and agree that in your shared care agreement before you even get to the point of selecting and screening your patients. So in addition to the patient understanding and agreeing to receipt of a serial prescription, the community pharmacist will have that discussion with the patient about the actual pharmacy process and the collection of serial prescription medication. So they'll cover aspects like due dates, the fact that there's no longer the need to order the items from the practice each month, and there's some flexibility around dispensing for things like holidays or extended time away if you're working away. Can I have the next slide, please? So the first point is to look at how you have that person-centered discussion with your patient. And this is very much a redesign of processes within your practice. So there is the potential that this discussion ends up being framed as a real kind of process-centered conversation, whereas what's really important is that we try and frame this as a person-centered conversation. So the key element is about how serial prescriptions can really be of benefit to your patient. And the key document within the toolkit that supports you with these initial discussions is displayed here. It's called Questions to Prompt a Person-Centered Discussion. So apart from those initial discussions, it can also be really helpful at that review stage, and in particular, the first review. Can I have the next slide, please? So the other key document to help you around the initial discussions and at review stages is this person-centered discussion checklist. And this checklist should actually be equally helpful for community pharmacy teams as well as GP teams to support you when discussing serial prescriptions with your patients. Next slide, please. So we're just going to take a moment to pause here, see if anyone's got any questions or maybe some experiences to share in terms of how you've had those discussions with your patients when you move them to serial prescriptions, different methods of communication, and maybe how you've got on with testing those.
No questions or any stories has come through yet. But if there's anybody who want to share the story, you're welcome to raise your hands and unmute your microphone. We'll unmute your microphone, and you can share any of the good tips or good stories for learning.
And this is where it's hard to know when you're presenting virtually whether anyone's actually busy typing into the chat box or whether everyone's being very shy or maybe just don't have any questions right now. Okay, so there's nothing coming in just now, so we'll move on to the next slide, but obviously if things do occur to you, then please feel free to either pop your hand up or drop them in the chat box. So whilst one specific method of communication doesn't necessarily suit every practice or indeed every patient, you can find within the toolkit some locally developed examples of patient information letters. So we've got two here that we've highlighted. One was shared by Kirimiro Medical Practice in NHS Tayside, and the other was shared by one of the teams from NHS Highland. Next slide, please. So another method of communication you can use is a patient information leaflet, which would inform patients of the basic changes to the system, and there's an example of this within the toolkit for you. So written communication can also offer some reassurance around areas of care which are unchanged, but might potentially be of concern, such as their ability to see their GP. And if at the point of dispensing, the patient's hearing about serial prescriptions for the first time, for example, the leaflet was attached to the serial prescription for the community pharmacist to give to the patient, and if the patient's not already registered, then obviously they need to be registered at that point for MCR before the community pharmacist can dispense. And as Mark mentioned earlier on, included in that registration is the requirement for the patient to agree to the electronic transfer of the information between the community pharmacy and the GP. So just a note here, if the patient declines to register and effectively declines the serial prescription, the community pharmacist should complete the registration, dispense and claim the first episode, then send a TSR informing the practice of the patient's decision and request that they return to a standard repeat script with that decision noted on the patient's record. The community pharmacy then needs to withdraw that patient from MCR. Next slide, please. And that sounded like quite a lot of information to just be putting out there in one slide, so we're just going to take a moment to see if any questions have come up.
So no questions come up from the chat box. And thank you, Hilary, for sharing that. She says that this does use the point as she used this point as an advantage to patients. There's a reduction in the potential for error at the practice end when generating repeat prescriptions.
That's really helpful, Hilary. Thanks. That's actually the first time that's come up in that particular wording, so we can pop that into our top tips document that will accompany the recordings of these workshops when they're made live. Thank you. So does anyone else have any experience to share, maybe where something's worked, where something hasn't worked, maybe text messaging or links on practice websites to information, stapling notes to scripts, that kind of thing? Has anyone got anything that they've maybe tried in the past? Thanks, Margaret. I'm relieved I got the order right. Stuck to the script and got it all in the right order. Okay, so there doesn't seem to be any questions coming through just now. But obviously, if there are things that come to you, you've got time until we wind up the workshop to add anything into the chat box. So if we can move on to the next slide, please. So obviously, the toolkit itself won't work in a vacuum. It is just a resource to help your practice think about how you're going to implement serial prescribing in your team and in your local processes. So how each practice will use the toolkit is going to differ. What you really need to be thinking about is how you build serial prescriptions into your daily practice processes. And the point that Mark made earlier on is so important around how you balance that workload and balancing it from the point of view of the practice in terms of thinking about those reviews and TSR processing, but also in terms of the community pharmacy and having that agreement about when you start moving patients across the serials, how many will you be moving over a certain timescale so that they're equally prepared. And all of this can be done within that shared care agreement, which again is a document you'll find at the beginning of the toolkit. So one example is how you potentially are going to stagger the serial prescriptions by birthday month. So when that time comes to review, they're obviously not all coming into the practice at the same time. And taking that measured and balanced approach towards your practice workload is what really helps ensure that sustainability. And none of this is stuff that I will be telling you for the first time, I'm sure. It's just one of these things where you don't want a huge move of a large number of patients across in a short timescale, because you're just going to be building in that bump in workload further down the line. I'm just going to hand over to Adeline for the next slide. Over to you, Adeline.
Thank you. So as we mentioned at the beginning of this workshop, it's all the work that we've done is underpinned by QI methodology. There is a suite of QI tools that you can freely access to support implementing your serial prescriptions. We have only highlighted some of the tools today. A driver diagram visually presents a team theory of how an improvement goal will be achieved. A process map helps the team visualize the serial prescribing process. PDSA stands for Plan, Do, Study, and Act. PDSA cycles are an ideal QI tool that can be used to test an idea by temporarily trialing a change and assessing its impact. A data measurement plan sets out details for each measure proposed for an improvement project, and the data collection template helps you to collect appropriate data for informing your work. The link to the NEST QI zone, where you can access more information on how to use the QI tools, are shown in the chat box, and it is also provided in the Serial Prescription Toolkit. You may have your local QI support team. These specialists can help you understand these QI tools more in depth. The other local specialist you may be able to call on is your local e-health facilitators. They can also help support your implementation of Serial Prescription Toolkit. And yes, thank you, Caroline. Most boards have e-health facilitators that have years of experience around serial prescription. So I will encourage you to seek them out. I'm going to hand you over to Eloise now.
Thank you, Adeline. So we're very nearly at the end. So really this is about putting our contact details out there. If you do have any questions or queries or suggestions of things that we can add, the link's gone into the chat box just now. Please drop us an email if there's anything that comes up that you maybe thought of after the event, because we know that happens too. We know you're really busy, and we really appreciate the time you've invested in today's session. We hope you have found, at least one or two learning points. And we factored in a few minutes at the end here within the session for you to complete a very short feedback survey. So this helps us improve any web kind of based products that we offer in the future. So we really appreciate you being as honest as possible. The link will pop up in the chat box. So the survey will pop up if you click on the link. We'd ask you to complete it and then just hit submit at the bottom of the page. And just to reassure you that responses are all anonymous, you can be as open as you wish. We really take feedback in the spirit with which it's given. And once you've completed that survey, please feel free to log off from the call. And in the meantime, it remains for us as a team to thank you for your time today. We wish you the very best in setting up or reviewing your serial prescriptions. Keep in touch, let us know how you get on. Any feedback about whether the toolkit's been useful in supporting you would be really great to hear. And one last thank you, given that it's the final workshop, is an enormous personal thank you to the team who've been working phenomenally hard behind the scenes to have these workshops running. Special thanks to Elaine and to Margaret and Caroline for joining all 4 sessions. It's a huge amount of commitment and we really value their expertise in answering these questions for us. To our clinical leads, obviously Graham Gould's not on today's call, he's been at the other 3 workshops, and to Mark especially for focusing on today's session as that community pharmacy clinical lead for us. So thanks again to everyone, and Merry Christmas. I guess it's that time of year already, and please look out for the emails in the new year, which will obviously confirm that these webinars and any associated supporting documents will be available on our website. Thank you and goodbye.